Welcome to the Breathe Easy, Breathe Well virtual event. As a reminder, this presentation is for informational purposes only, and neither to replace the advice of your physician, nor intended to diagnose, treat, or cure your condition. Today, we have Ashley Oswald with us. Ashley founded Oswald Digestive Clinic in 2016 after being frustrated to see people struggle with their gut health, while knowing that there are ways to help them improve and often resolve their bothersome symptoms. After struggling with her own gut health issues, from being on and off antibiotics for 10 years as a child to her early 20s, Ashley is passionate about helping others to improve and eliminate their gut health issues too, and to regain their freedom in life. She has completed 7 years of schooling in nutrition science, including a year at Harvard's Brigham and Women's Hospital, and has worked in a variety of settings in the healthcare system, so has a unique big picture view of where the gaps are. She has been published on ABC, CBS, Fox, and NBC, has spoken at top 50 hospitals across the country, and has been invited to be on guest panels at leading universities. With Oswald Digestive Clinic, she is working to fill healthcare gaps, helping their clients finally go from gut struggles to gut freedom, so that they can get back to living their life on their own terms. She is also an optimist, explorer, and nature lover. Welcome, Ashley.
Thank you, Dawn. Thanks for having me.
Absolutely. I'm so excited you're here to join us. So today, Ashley is going to discuss how our gut health has a direct impact on lung health. Ashley, can you tell us a little bit about your background and why you decided to get into gut health? Like what was the drive for that?
Yeah, of course. It's two parts. As mentioned in my bio, I've worked in a lot of different settings in the healthcare system and just realized there's huge gaps, especially with like irritable bowel syndrome, where people get diagnoses, but then don't really get great options for how to help themselves with it. And we know, Dawn, that nutrition can significantly improve and eliminate those issues, especially functional nutrition. So I really wanted to be able to help people in a way that they weren't getting helped by the system. And then the other part is with gut issues, it can significantly decrease quality of life. And so I just really wanted to help people get their quality of life back, be able to enjoy life more. And as Hippocrates says, it all starts in the gut. So by improving the gut health, we really can improve a lot of these other potential symptoms that people are struggling with, like lung health and breathing, like we're going to talk about today.
Yeah, absolutely. There's like we have the gut brain axis and there's also the gut lung axis. So by educating people on how there's that connection between gut health and breathing, I think is very important. So can you tell us if there's a research connection between gut health and breathing?
Of course, as you mentioned, there's that gut-lung axis. So we have some research showing how in kind of animal and human models where the lung to the gut, if something negatively impacts the lung, like for example, in a mouse study, they stimulated the lungs with LPS, which is simply an endotoxin. It can stimulate inflammation. And they found that in the gut, there's an increased number of bacteria that happened as a result of that, showing that connection. Also, when somebody gets pneumonia, they have found that the intestines also get some injury to it, and it can decrease the health of the gut lining. Wow. And then vice versa, when short-chain fatty acids are given to mice, and we'll talk a lot about that later, it was found to reduce inflammation in the lungs. So there's definitely this bidirectional pathway between the gut and the lungs, and we're going to talk about some of these things in much more depth as we go on. And then I also kind of have my own story of where I was having really random breathing issues. And Dawn and I had talked about this, but long story short, we found that I was exposed to mold. Mm-hmm. So there's a lot of different potential root causes that can contribute to breathing issues. And once I started to heal myself and recover from that mold exposure, those breathing issues went away.
Wow, that is amazing. And I think a lot of people don't realize. I have another expert on here, Dr. Gail Clayton, and she's going to talk about mycotoxin exposure and how it's prevalent. I want to say she said 30 or 40% of all buildings in the United States. Like how many people actually realize that? Like that's crazy. That's a huge amount. So, and some people unknowingly are exposed and they just they don't think that that's what it is. And because mainstream doctors don't understand how to test for and treat mold toxicity, it makes it really difficult because then people start to think it's in their head. Like,
Yes.
what's going on with me? Like, I'm so sick, but the doctors can't figure it out and they keep telling me it's in my head, so it must be in my head. When in reality, the doctor that they need to see, they haven't found yet. That's the issue.
Yes, exactly. I went to a nurse practitioner a couple of times for this, and she's more holistically minded. I totally don't blame her because it wasn't really on my radar either. But I was offered an inhaler, and it just didn't it didn't mesh right with me at the time. So thank goodness I kept searching, and then came across this as being the root cause.
Yeah, that's awesome. And it's good that you kept searching because oftentimes people just give up. So, what is the first way to optimize gut health to potentially improve or eliminate breathing issues?
Yeah, so we're going to talk about kind of categories. So this first category I want to begin with early life. So
Mhm.
really when somebody's in the mom's womb and the baby's really early life, and there's some really fascinating research here. So first of all, and so this will be really relevant if somebody's thinking about getting pregnant, or if somebody's an adult struggling with breathing issues, it might be able to connect some dots for them where they realize like, oh, it actually probably started here, but we're going to talk a bit later about it's not, oh, this happened when I was in the womb, now I'm doomed for life. There's still things we're going to be able to talk about where you could do and make significant impact. But so in the womb, if some research found that if mom was on a PPI, so proton pump inhibitor, which basically is an acid blocking medication for stomach acid, which is commonly prescribed for acid reflux, shouldn't really be used for more than a few weeks, but it so often happens that people are on it for life, mostly because they're not connected with a good dietitian who can help them get to the root cause or a functional medicine provider. So anyway, mom was on that during pregnancy. They realized that the child had an increased risk of developing childhood asthma. So
Wow,
that's pretty huge.
that is huge. I didn't.
Yep. Yeah, yeah. And then also in a mouse study, and take it as it is, but it's a start. They found that when they were given short chain fatty acids during pregnancy, again, we'll talk more about what that is, the offspring were protected from allergic lung inflammation.
Wow.
So mom's eating really does matter when it comes to a baby being born with asthma is what we're realizing. And then it goes into the type of birth, which a lot of people are recognizing this already, C-section versus vaginal, where if somebody's born C-section, the baby can be at an increased risk of asthma, allergies, autoimmune than if they were born vaginal. And I understand sometimes that's needed, but what's really cool is there's some new research and new kind of ideas coming out about this thing called vaginal seeding,
Mhm.
where if a mom needs to have a C-section, and I'm not a doctor, but I've been reading that a lot of times C-sections aren't totally necessary. So talk to your doctor about that too. But so there's this vaginal seeding where they can actually, if a mom's having a C-section, put like a cloth in the kind of vaginal canal and get all this bacteria on it. And then they can rub it on the baby to help inoculate the baby in a way that it's not getting from like a vaginal birth.
Yeah. I remember when I was back at Maryland University of Integrative Health, and one of my professors was a naturopath and a midwife. And I asked the question about, having birth via the vaginal canal route or having birth via a cesarean, and the difference in immune system function and how it affected gut health. And she's like, homework. So I had to research it, right? And so I found some of the studies, I think, similar to what you found, but I also found a very small study from somewhere in South America. And it was only like 10, maybe 15 moms who had delivered. And about half of them had a vaginal birth and the other half had a cesarean. And what they found was that even the bacteria on the baby's skin was like not good bacteria. It was like the bacteria that was floating around the hospital. And
Yeah.
so I remember saying, if I ever have to have a cesarean, they're just going to swipe it and they're going to rub it all over that baby and put it in its mouth because I need to jumpstart that immune system. And so, I have asthma and bronchitis, chronic. And I mean, I'm definitely in a better place because of a lot of the things that I've incorporated with what we're discussing throughout this entire event. But the simple fact is it started with my mom and
Yes.
then proceeded on to other things, the amount of antibiotics I had in my life, some other medications that kind of stimulate asthma and other respiratory issues. And so I think that is super important for moms to go in and say, look, if I'm stuck with having to have a cesarean because my child goes into distress or I do, they have to advocate for themselves or have somebody there that advocates for them or have it part of their birth plan, period.
Yeah.
It's huge.
Absolutely, it is huge. And some of the research is showing that it might take about a year for a C-section baby's bacteria to get to the spot that a natural birth was.
Wow.
Is a
And
year.
that would be saying if they had no antibiotics, right?
Totally, exactly. And we're going to get to that too, because in the first year, as alluding to, like antibiotics within the first year greatly increases the risk of asthma.
Yep. Yep, absolutely.
Yeah.
So, what is like the second way that we can help to optimize or improve or even eliminate breathing issues?
Yeah, and I want to say two more things about the
Oh,
first.
okay, go ahead. Sorry.
Yes, because these are important. So breastfeeding as well can decrease the risk. Until about 4 months of age, they found a significant reduction in asthma at 6 years of age. And then also in the first year, if a baby has higher levels of these short chain fatty acids, which we'll talk about what foods you get from that, they have a less likely chance of getting asthma within 3 to 6 years of age. And in the first years, if a baby and child has exposure to a pet or farm, that helps to decrease the risk too. So a lot that can be done in those first years.
That's amazing. And try to avoid the antibiotic route.
Yes. So number
That's
two,
huge.
we're going to talk about the microbiota, which I'm sure people knew we were going to talk about at
Yeah.
some point with my specialty in gut health. So there's I think some people don't fully understand what the word microbiota means. So I do want to explain that to start. So microbiota, it's this community of bacteria and fungi and viruses and protozoa and archaea that's all mostly in the large intestine, but really all over the body. And then microbiome is that word that means the genes of that whole kind of community of microorganisms.
Okay.
And it's really a significant amount in microorganisms, estimated to be about like 5 to 10 times that of human cells.
Yeah.
And then the genetic expression, so much more than that. So it really kind of begs the question, like, what are we really,
According to Brian Walsh, I think we're like 98% bacteria from the research he's done. Like, and people want to get rid of bacteria with all their hand sanitizer and washing their hands 1,000 times a day, and you are literally destroying yourself by doing
Totally.
it. Yeah. So, sorry, go ahead.
Absolutely. And that's like leads into, how reduced diversity, like I think most people know what diversity means, a lot of different types, because it's, most people have E. coli in their gut. When does E. coli become the issue? It's when it's like not a part of this diversity that can keep it at bay and not to cause issues. So they found in the research that for respiratory issues, it can make it more kind of hypersensitivity, reactivity to kind of food allergens if somebody has reduced diversity in their, and then certainly the dysbiosis, that like imbalance basically found to be a high influence on asthma kind of pathogenesis, like the disease process of asthma. So that's like the antibiotics again, the proton pump inhibitors, and just other drugs that could really affect those bacteria.
Yep. Yep. And I think antibiotics are a huge thing that we have in our society today. It's why we're starting to have antibiotic resistant bacterias. For
Yeah.
example, MRSA. I always call it MRSA, but my medical professional friends are like, don't call it MRSA. So MRSA. And then, when we're like, for example, when we're using like the antibacterial soap and the antibacterial hand sanitizers and stuff, I don't think people understand what they put on their skin ultimately gets inside and it affects everything. So the more they're using that stuff, it might as well be, let's go ahead and orally take an antibiotic because it's affecting the bacteria everywhere. And I think another thing that a lot of people don't know is that vitamin D is absorbed through the skin. Obviously, we know this, like it's activated in the body, and it needs bacteria on your skin to do that. It has to have it. And if we are constantly washing it off, what do we do? I think that's one reason why like Italians have such like a long lifespan is they don't shower daily. And so they're getting that bacteria like building up on their bodies, and they're getting out in the sun. And, I think it's Sardinia has one of the highest populations. They're a blue zone in terms of people over 100 years old. So you take that into consideration, you take the lifestyle into consideration. Obviously, they're a little bit less stressed than Americans and Europeans, but other Europeans, I'll say Northern Europeans, but it's definitely something to take into consideration, like the other habits that they have that I think help them to be healthier in general. So
yeah, absolutely. That's such a good point. I think most people don't even think of there being bacteria on their skin, outside of like, oh, I touched something with bacteria on it. I need to get it off.
yeah,
Where there's actually this whole, microbiota on our
right.
skin.
Well, when you mentioned children being around animals and farms, they are so like kids just pet the dog and put their hands in their mouths and they put it everywhere. And sometimes they even pick up dog poop and do the same thing. I mean, they're getting exposed to things that in a household that doesn't have an animal, they wouldn't. And that actually helps. Those bacteria help us to fight other bacteria off that aren't supposed to be in our bodies.
Yeah. And even having houseplants can help too to increase diversity.
Absolutely.
So lots we can do. So the question comes to, all right, Ashley, how do I like support a healthy microbiota? How do I get to this like spot to kind of help my breathing? So it's really four-part. The first one is what we just mentioned about the environment, the pets getting dirty in the dirt, having plants in your house. The second one, caution with the meds, like we talked about. Then, of course, the food things are the prebiotics and the probiotics. So we need to be eating kind of fermented foods that have these good bacteria, and then also the food for those bacteria, the prebiotics. So that's like fiber, soluble fiber, and resistant starch. So foods like beans and lentils and green bananas and potatoes, cold potatoes, especially like a cold potato salad. And really what I say for people is you don't need to hyper focus on specific foods. If you're eating a lot of real whole foods and a lot of color and etc., you're going to be getting these prebiotics.
Yes, exactly. So, what is the third way that you focus on improving someone's gut health that may help them, obviously, with respiratory conditions?
Yep. Number 3 is going to be this category of thinking about root causes. So I know I say root weird. I'm from Minnesota.
It sounds more like Canadian. But
yeah.
yeah.
Yeah. So root causes, as far as, we want to optimize the gut so it's functioning as best as possible. And what we find at our clinic is often when we do this, people's food sensitivities go down. Like
Wow.
they don't have as much reaction to food. I had one woman who came into our clinic eating about 10 foods max just because she couldn't tolerate any more than that. Like no eating disorder or anything, just like her gut couldn't tolerate it. And we were able to improve her gut environment, fix those root causes of her gut. And now she can eat almost all foods without having reaction, like a real full foods diet. So it's super cool to see. One thing that has some interesting research for asthma is low stomach acid. So hypochlorhydria is this fancy word for basically low stomach acid. And there was research from the 1930s that showed how, one in specific was 200 children, 80% were found to have low stomach acid. They gave them some stomach acid basically, and they found that there is these kind of improvements in their asthma. And what's interesting that I actually didn't know about until I was prepping for this is that when children go into puberty, typically their stomach acid goes up. And so there's these spontaneous remissions in asthma around puberty. So it really makes us wonder, could that be because of that change in stomach acid?
That's really interesting because I've always heard about the correlation. I often get asked, do I have low stomach acid? And I'm like, I probably do, but I have no symptoms. And it doesn't mean just because you don't have symptoms that it's not there. And so normally I would do like raw apple cider vinegar shots every day, but I just had a food thing done, a food immune response test done, and I have to eliminate the apple cider vinegar for now. So it's like I actually am getting the HCl tablets with pepsin.
Mhm.
And so we'll see like if that also continues to improve the asthma responses that I have since I've been living in Italy. Now, granted, I am so much better than I was 2.5 years ago when I got hospitalized, but I still have days that I struggle. And that is another reason that I decided to put this together, was to have this accessibility to people to be able to be like, oh, maybe I have low stomach acid, and understand that low stomach acid has the exact same symptoms as high stomach acid. And literally, there's like 2 to 5% of people who are diagnosed with hyperchlorhydria, the acid reflux, the stomach acid issues, actually truly have high stomach acid. Everyone else, it's low, and especially in the elderly population, because as we know, as we age, our stomach acid naturally reduces. And so I think it's interesting when you said how that study explained that when a child hits puberty, their stomach acid naturally increases. And I don't know how many people tell me, I had asthma as a kid and I outgrew it. Well, of course, I didn't have asthma until I was an adult. How do you outgrow it if you're an adult? Well, I think you can definitely manage it better. I think you can definitely reverse issues with it, reverse or have significantly less. I hope that I can completely cure mine. And I know I'm not a medical doctor, guys. Like, I'm not supposed to use that word cure for you, but I could use that word for me and say that that's my goal, is to cure it for myself. Because being reliant on any medication, I'm not a fan of it. Just not a fan. Being in the
Absolutely.
functional nutritional world, like that's your goal, is to use nutrition to help a person heal their body. And so that's my
Yeah.
goal.
Yes, and we'll talk about the significance of research around food sensitivities contributing to asthma. So, how do we help decrease sensitivities? We need to get as upstream as possible. And that
Right.
stomach, if people don't know, is really this reservoir. It holds the food and it's supposed to be very acidic to start that breakdown of food so that our body doesn't have reactions
Right.
to the food. There's other factors that go with it, but that is kind of the role. And if somebody has low stomach acid, it can relax the sphincter between the esophagus and the stomach. And as you mentioned, Dawn, that can be like the symptoms of acid reflux, where people think, oh, I have too much acid, but really it's the other
The
way.
opposite. It's the opposite. The other thing that I say is that because there isn't enough stomach acid, I'm not sure if there's research on this because they haven't looked it up. There probably is, but that the food just sits there. How do you feel when food just sits there, right? And especially if it's something like, let's say you're eating bread. Well, you just ate bread and you have this much stomach acid when you're supposed to have this much, right? And it just soaked up everything you had in there, right? And so now you have that acid reflux. And so a lot of people are like, every time I eat pizza, every time I eat tomatoes and bread, like it's not the tomatoes, guys. It's the bread. It's the bread soaking it all up. And that's an indication that you have low stomach acid. Even if
Totally.
you don't have a respiratory condition, that is an indication. So yeah.
Yeah, and it's really hard to test, like you mentioned. We're not going to go sticking probes down everybody's nose. And it's, so what you're doing, Dawn, like if people are using apple cider vinegar or using some stomach acid tablets, seeing if it helps, that's really kind of
Yeah.
the more gold standard at this point. And then some of these other root causes that I want to mention is there's a celiac asthma connection too. So if somebody's having different gut issues, and I think most people, when they think of celiac, they think diarrhea, and it's really not totally the case. It can present as headaches for some people, it can present as constipation for like 20% of people who have celiac disease. And so here's the trick, and I want to make sure to share this because it's really important, that if somebody's cutting out wheat to see if it's going to help with their asthma, cutting out gluten, you're not going to be able to do a celiac test and have it be accurate after you cut it out. You need to be eating the gluten for at least 2 weeks. If you're eating gluten not having symptoms, you need to eat it for 6 weeks before testing in order for it to be accurate. And when I say eat it, I mean like 2 slices of bread a day at least.
Wow. That's really interesting because another lab analysis I had came back with, I can't remember the name, but some kind of autoimmune condition that is correlated to celiac disease. And I was like, I don't have celiac disease. I don't have gluten sensitivity the way I understand gluten sensitivity. Like there are people who are non-celiac gluten sensitive, and I was like, I don't have those symptoms. And then there's people who've gone and been tested for celiac disease and they come back negative, and we're like, just because you don't have it, like you're not positive for it, doesn't mean you're not sensitive to it. And I don't really eat gluten here in Italy anyway. I mean, occasionally my husband, when I would go out for a pizza, But the gluten-free food here is unbelievable. It's not like the US at all. It's like amazing. It's like soft. Like when you go to get a pizza that's gluten-free, it's like eating regular pizza. It is
Wow.
amazing. Yeah. So and it's possible. Like you can even get things like profiteroles, which are like little beignets that are covered in chocolate, gluten-free and dairy-free. Like it's amazing what they do here in this country to ensure that people are included in their lifestyle. Because pizza
Wow.
and pasta and profiteroles, the three P's, are important to Italians.
All right, everybody, move to Italy if you're doing an
Yes,
elimination of gluten.
absolutely. So, can we go to question or tell me about number four, like the fourth way that we can help balance this?
Yeah, yeah. And the last couple of things on the last category is just
Okay.
like into mold or like parasites. So there are like other things that I want to make sure just people realize that wasn't, we didn't talk about everything. But
Yeah.
all right, so the fourth way is food sensitivity, is like I've kind of been alluding to this whole time. I'm going to give a little bit more specifics, but so according to some investigators, hidden food allergy, and that word allergy, some people use it and also mean sensitivity, so IgE, IgG, but it can be the sole cause of asthma or a major contributing factor in about 25 to 90% of cases. So I know that's a wide range, but even just on the low end, 25%,
One out
that's
of
like pretty
four.
significant.
Yeah, that's 1 out of 4.
Yeah, yeah. So here, this you might find interesting. There's a study where 322 kids under the age of 1 had 85% of them had asthma, and they were either put on a 6-week hyperallergenic diet. So like meat-based formula, beef, carrots, broccoli, apricots, that's all. And 91% of the kids had significant improvement in their breathing in 1 week, and 61% had almost complete symptom relief.
Wow.
Yeah, and
Wow.
another really interesting study was in the hospital, which is like so cool, especially, yeah, anyway, I digress, but 41 hospitalized individuals were put on an elemental diet or a control diet. So if people don't know, elemental diet, it's basically like I explain it as food broken down to its smallest component. So it really can decrease immune reactivity to foods because it's, proteins broken all the way down to amino acids, fats and carbs, same, broken all the way down. So what they found was that in 43% of those on the elemental diet, they significantly improved in their breathing and only 6% not on it.
Wow. That's how you can just see how there's such a huge impact on lung health and what we eat.
Yes.
And it isn't always just dairy and gluten or dairy and grain products because sometimes there's that cross reaction of gluten with the other grains. I mean, even quinoa is 100% gluten free, but it has two enzymes in it that act like gluten. So somebody who's sensitive to, like super sensitive to gluten, could still be sensitive to quinoa, even though it's officially a gluten free food. And
Mm-hmm.
so I find that really interesting. Like that is wow. That
Yeah.
needs to be like more people need to know this. Seriously.
I know, I hear you. And it's like we could do these elimination diets or do mediator release testing, which we could talk about. But ultimately, I mean, the best way to know would be to do an elemental formula. However, I really, really want this is super important because to caution people not just doing it on their own, or if they do, make sure they have some sort of like medication or a provider, because what can happen is someone goes on elemental formula, but then when they start to reintroduce foods, they could have a really severe asthma attack when they're reintroducing. So I want to make sure we say that.
Okay, thank you for that. I think that's really important that we know that. We definitely do not want someone to have a severe asthma attack when they begin reintroducing foods. It's kind of like, if you get a new medication from your doctor and they're like, have a seat in the waiting room for about 20 minutes. Let's see if you have a reaction. Like, I feel like that's what's necessary with this type of protocol. So yeah, because it's a little bit
Yeah,
different than just a basic elimination diet. It's
yeah.
much more in depth than that. So yeah.
Right. Yeah. So people can kind of start if they just want to get started right away. They can trial, gluten, dairy free, see if they notice any improvement. There's, like I mentioned, mediator release testing, which actually tests like 70 some foods on their own bile and sees how many mediators are released when your cells are exposed to that food. And that's how the company can kind of figure out what foods might be triggering symptoms when you only eat the foods that they found to not trigger those high mediator release. Allergy testing for foods isn't completely accurate, like 40 to 60%. So really that elimination reintroduction or using an elemental formula is like the best way to do it.
Yeah. I've had a couple colleagues send in like two different blood samples to the companies that do the food allergy testing, and they gave two different names, one their true name and the other one just a fake name, and had two completely different results. And when
Wow.
they called and were like, "Hey, what's the deal with this?" They were like, "Well, you should have told us that you sent two samples in." And they're like, "This was my point to prove that this isn't effective. It's not accurate." I mean, a handful of the things were the same, but not everything. And so I think that that's important to know, that the allergy testing that we have available, especially in mainstream medicine, is not the best. It really isn't. There's a handful of the, oh, my brain is not working, the alternative companies that will have a little bit better results. But even so, I mean, maybe you've been stacking up on gluten and it says that you're sensitive to gluten, but if you hadn't been stacking up on gluten, it wouldn't even showed up. You know what I mean?
Totally. Absolutely. It's such a good, important conversation. Like we can go through and talk about all the research on all the specific foods. It might get a little bit boring, but I think ultimately, like what we talked about would be a good spot to start. And then something else I want to add is that hypoglycemia, so blood sugars running low, can also trigger breathing issues, which I found super interesting. So just kind of simply cutting down on sugar is that real whole food kind of eating plan can help. And the research they did was on 12 individuals, and they showed that all of their asthma improved, all 12 individuals. Like the mechanism isn't clear, but basically, once they were able to eat in a way that stabilized the blood sugars, their asthma improved.
That is so fascinating. I mean, I have reactive hypoglycemia. I know a lot of my patients suffer from that. It is important that we understand this and that there is a correlation. So again, like I am just learning so much from what you are telling me. I mean, I've done research myself, but I think I've taken like at least five different things so far that you've just introduced me to that is fascinating. So there is one more way that we can work on optimizing gut health and lung function. Can you tell us what that is?
Definitely. So this category is all about replacing nutrient deficiencies. It can be a cycle. If somebody's having gut issues, especially low stomach acid, they could not be absorbing foods and nutrients properly. But then also, if they're getting deficiencies in different nutrients, it can prevent the gut from healing properly. And as we mentioned, there's that gut-lung axis, so it really can connect. So there's a bunch of vitamins and minerals and things that have good research showing how it could improve asthma, like magnesium and vitamin C. And we can certainly like go through them all. We could have like a 3 hour presentation just on. I think what I always come to is it's testing is best because then you have a good understanding what you're low in cellularly, and then we can kind of use 6 months to kind of more mega dose and replace those levels. Some of these things, like for example, magnesium, it's estimated that 70% of people are low. For most people, it's pretty safe. Always check with your main kind of nutrition literate healthcare provider. The nutrition literate part is like key because there still are some cases, like if someone's their potassium runs low, it's not going to be smart to give them a lot of magnesium. It could cause issues. But basically, like magnesium, it can help to relax the smooth muscle of the lungs. It has anti-inflammatory benefits. It can decrease responsive histamine, which is a whole nother thing when it comes to asthma and breathing. And it was shown in animals to decrease the risk of kind of anaphylactic reactions. So, and then the other thing, if people don't have access to testing, you could check with your nutrition literate provider about maybe doing like a comprehensive nutrient powder and just kind of seeing if they notice benefits in their breathing.
Yeah, absolutely. That's some great information there, Ashley. So We've covered a lot today, and believe me, I am taking so many things away. But do you have one takeaway for our listeners today?
My one takeaway would be to find a provider that could help you look at your whole story, look at where different triggers might be to be able to best understand where there might be adjustments to truly help them improve their breathing and asthma. Like, I hope if anything, people, realize some pearls as they're listening to this, but also realize how much could contribute to asthma and breathing issues. And so creating a team around them to really support them, I think is just so key to really getting good results.
Absolutely.
And I want to share one quick story of
Yes.
another client who came to me was having a lot of breathing issues. And this is just kind of an example of how the root causes can be so different. People might run themselves in circles, eliminating foods and et cetera, et cetera. But he was having a lot of breathing issues. Upon his looking at his story, his history, his symptoms and everything, and even lab results, I realized, he was having a lot of yeast and candida overgrowth issues. So
Mhm.
we were able to use some botanicals and different kind of a supplement food regimen. And within a month or two, his breathing got 70% better and then continued to improve.
That is amazing. And I love having these actual real life stories, not just like, oh, a hypothesis here kind of thing. Like actually you having a patient who came in with respiratory distress and made lifestyle changes and in less than 2 months was 70% better. Like that's astronomical. And
Totally.
I'm hoping that people are taking something away from that, that understanding our diet and our lifestyle has a huge impact on our respiratory health. And that's one of the things, like, my biggest thing, I believe, is environment, because Italy, Rome in particular, has not really good clean air. Like the air here is very polluted and there's a lot of mold. And so when you take those things into consideration, when I go back to the US, I'm like, yay, I can breathe. Like I can go exercise, right? And then I come back here and I'm like, okay, how soon is it going to be before I need an inhaler again? And again, I do not use it or need it to the extent that I did 2.5 years ago, but I still have moments where I need it. And so this is also just to let people know you may just get better. You may sometimes still need that inhaler, but maybe you don't need it all the time. You don't need to be puffing 4 to 6 times a day with one and the steroid inhaler and the prednisone and whatever else comes along with it, because there are so many medications that, you know, help people with respiratory conditions. And considering I have two, they have to look at both of those aspects. They can't just look at the asthma for me. And I know that I'm not the only person who has two respiratory conditions. So that's the thing. Maybe you get really, really, really good with one where it never bothers you anymore, and the other one is controlled.
Mm-hmm.
And the whole point is that you have better management and you get a better quality of life. And I hope that's what people take away from this.
Yeah,
So
totally. And I think more tools will be coming out. Like I had a client once who she wore a necklace with a air filter. So it was like a portable
I
air.
have one.
You
I
do?
have one.
Does it
Yes,
help?
Dr. Mercola sells that. I mean, like, I'm not doing a
Oh,
plug-in for Dr. Mercola, but I guess I did. He has them and they're amazing. And he's got these little air purifiers that are like this big, and they're great for like a room that's at like a 10 by 10 or 12 by 12. And they just completely clean the air. But yeah, especially when I go around Rome, it's like right up here under my nose. So I don't have to
mm,
smell the cigarette smoke or anything. It's amazing. It really is. I love mine.
so cool. Great.
Yes. So, how can our viewers find out more about you, Ashley? Maybe work with you if you're taking on new clients? Like, what's the best way for people to find you?
Yeah, I'd say our YouTube channel is great. So Oswald Digestive Clinic on YouTube, and you can learn a lot more from our videos. And then we do offer a free gut health call, which the link is under all of our YouTube videos as well.
Okay, perfect. And is there anything else you would like to share?
Outside of our kind of freebie that we'll be giving away, I think that about wraps it up. Don't hesitate to reach out if there's anything I can help, you with to the audience.
Perfect. So, can you just tell us a little bit about your freebie?
Yeah, it's a download 5 ways to improve gut Health and End Food Intolerances for Good. So it has some of what we talked about today written down, and I think even more so that you'll kind of learn from just that free download.
Awesome. Well, thank you so much today, Ashley. I really appreciate you taking time out of your busy schedule to make time for all of our viewers and me.
Yeah,
Thank you
me
again so
too.
much.
Thanks for inviting me, John, and thanks for pulling it together. I know it's a lot of work, and this is going to be so amazing. So I can't wait for people to have access to your summit.
Awesome. Thank you. To my viewers, I will see you in the next interview.